Hi, I'm Natalie Henning, the host of the show, Ins and Outs of Medical Imaging. This is a production of Creative Communications in Jordan High School in Jordan, Minnesota. In this episode, I'll be explaining PET scans. Just like before, I'll be explaining how PET scans work, what it is, what to expect, how it has changed over time, and how it will evolve in the future. Let's get into the background and history of PET scans. Before we get any farther, we have to understand what PET scan stands for. It stands for positron immersion tomography. A physicist named Gordon Brownell and a neurosurgeon, William Sweet, made the first large-scale body imaging machine. It was used to detect brain tumors with sodium iodine. This happened in the 1950s. According to Cleveland Clinic, there are two ways to easily explain how a PET scan works. The first way is a PET scan uses a scanning machine to direct photons and subatomic particles that are emitted into a radionuclide, which is a radioactive atom that is attached to a specific molecule. That way sounds confusing, but here's another way. There's a small amount of glucose that is injected into the body's veins. The scanning machine then rotates around the body to determine where the glucose is being used in the brain. Now let's talk about what Cleveland Clinic has to say about CT, PET scans, and MRIs all relating to each other. First off, all three of them use magnets and radio waves to create the images for doctors to look at. CTs and MRIs create still images of the body, while a PET scan shows doctors real-time images. CT and PET scans are so closely related that doctors can order a scan called a PET-CT, which creates a 3D detailed image of what the doctors are trying to show. Also, some hospitals are starting to use PET MRIs. These scans create high contrast images. Let's talk about when the doctor would request a PET scan. Usually, doctors request a PET scan when your vital functions need to be checked. This could include blood flow, oxygen use, blood sugar, or glucose metabolism, and it can also identify organs and tissue that aren't working like they should be. If you have already been diagnosed with cancer, doctors may use PET scan to determine if the cancer has spread or reoccurred, if the effectiveness of the treatment is working or not, or to evaluate the diagnosis. If you're having heart problems, doctors may also use PET scans to determine the effects of a heart attack or areas on the heart, or determine the areas of a heart that would benefit from having a surgery. Now let's talk about what to expect when receiving a PET scan. You'll receive an IV injection of a safe amount of a radioactive drug. After you receive the injection, you'll have to wait for the medicine to move through the bloodstream and absorb into all of your organs and tissues. You lay on the exam table that will slide into the scanning machine. Just like any other medical imaging machines we have learned about in this series, you'll have to stay very still so the images don't turn out blurry. Sometimes you might need a PET scan with contrast. Let's get into what to expect then. If your doctor recommends a scan with contrast, it might be injected into your body, which is when you might feel a cold sensation run through your body, or you can receive the contrast orally. Some people are allergic to the contrast with the iodine base. In that case, they'll receive a pre-medicated contrast before the scan. The reason for a PET scan with contrast is to give doctors a better image of how organs and tissues are functioning and changing. With With cancer and PET scans, the cancer shows up bright. People with Alzheimer's aren't using as much glucose, so this shows up as less activity and more dark spaces in the brain. The part of the heart that lights up with glucose is the healthy part, while on the other hand, the dull colors are where there's no glucose being used, which also shows that that part of the muscle is decaying. The part that lights up in the lungs is the healthy part. If there was a blockage in the lungs, that part would show up as dull. Here's a video from the YouTube channel called And Still. This was published on January 4th in 2015. It's called PET Scan Animation. In the video, it'll show PET scans detecting tumors and cancers. Let's get into the video. Here we'll notice the glucose material is being injected into the bloodstream. Once the material is injected into the patient will be in the waiting period. This period usually takes about an hour. During this period, the glucose accumulates where the cancer or tumor cells are. This is because they are hungry to keep making the bad cells. Now we're entering the bloodstream to get a better look. The maroon discs here are the red blood cells. The hexagon with yellow tag are glucose molecules. In a PET scan, the scanner picks up the heavy metals. That's the glucose material, which is where the cancer and tumor is. Let's get into how PET scan has impacted the medical field. PET scans have made it possible for doctors to give a highly accurate, non-invasive way to see the function of the body and organs and tissue in real time. Doctors are able to diagnose cancer with earlier stages, which can lead to saving a life. Now let's understand how PET scans will look in the future. The resolution will be higher, there'll be better sensitivity, and the ability to target precisely through the more radio tracers. Thanks for joining me in this series, Ins and Outs of Medical Imaging. Comment below if you have ever had a PET scan done and what it was for. Thanks for watching. I'm the host of Ins and Outs of Medical Imaging, Natalie Henning.